My name is Eric Sorenson. I'm a neurologist at the Mayo Clinic in Rochester, Minnesota. Well, this study was designed as a phase 3 clinical trial testing the effects of insulin-like growth factor type 1 in patients with ALS. And this study was completed in response to two previous studies that were done, very large phase 3 clinical studies with the same drug, one in North America and one in Europe that had conflicting results. One of the studies appeared that the drug was beneficial for people with ALS, and the other study did not confirm this. This drug was before the FDA for consideration for use in ALS, and the FDA did not feel there was enough evidence to warrant its general use in ALS and requested additional data be obtained, and that's where our study was planned and initiated to try and answer that question. We gave the drug to 330 patients in North America, or the United States, and followed these people for 2 years. And in that 2-year time period, the study showed that there was no difference in the rate of progression of their weakness, their functional deterioration, or in their survival. And in all the areas that we looked, the two groups, the ones who got the active drug and the ones who got placebo, did identical in every parameter that we measured, indicating that in our study there was no sign that this drug was beneficial as we were administering it for ALS. ALS is a progressive neuromuscular disorder that results in progressive weakness and deterioration of muscle function. It affects almost all of the muscles of the body, including the arms and the legs, but also affects the muscles of the head and neck, so that people also have trouble with their speech, with swallowing, with breathing. And because it is a progressive disorder, it is a disorder that in the vast majority of people who have it eventually die from it. And that's, on average, that takes about 3 years or so from the time the disease starts. ALS is a relatively uncommon disorder. It affects about 1 to 2 people out of every 100,000 each year in terms of its annual incidence. There's a modest amount of animal data to suggest that this drug in the proper place still may be effective in the treatment of ALS. The question is we gave the drug, as was with the previous clinical trials, subcutaneously, similar that you would give insulin or other proteins. And the problem with doing that in ALS is that it's not certain that the drug being given subcutaneously is really being delivered to the right place in the nervous system. Because of a structure called the blood-brain barrier, there's good evidence that the drug there's evidence that the drug may not get into the tissues where we need it to get into. And so there's a lot of people exploring other delivery platforms to get the drug into the nervous system, into the environment where it may be more effective. And future studies will tell whether this drug still may have a role in the use of ALS, but it doesn't look like it will be used in a subcutaneous way that other proteins have been used for other disorders. Studying the drug and finding out that it doesn't work is actually quite helpful. People with ALS become very desperate for treatments and are willing to try lots of different things. And the rumor mill will generate some concept that a particular drug is helpful or is effective. And so now all the patients want to start taking this drug, and no one knows whether it works or it doesn't work. And so by doing these studies, even if it does not show that it's helpful, at least we can convince the population or convince the ALS patients that the drugs really don't work and that they're wasting their time and effort by chasing down expensive, unhelpful, and sometimes risky, unsafe treatments.